Hi there. My name is Dr. Kimberly Ernest, licensed psychologist, licensed professional counselor, president of PA Counseling, and founder of Live Up Counseling. And today on the How to Be Happy Hour, we will be talking about drug and alcohol treatment in an outpatient setting.
Hi, I'm Jonathan Reese, licensed professional counselor in the state of Pennsylvania, and I'm a clinical co-director here at Pennsylvania Counseling Services.
Hi, my name is George Acevedo. I'm an outpatient drug and alcohol therapist at our Reading Psych office.
Thank you.
Hi, I'm Kristen Wortleft. I'm a certified advanced alcohol and drug counselor, and I'm an outpatient therapist at York Psych and Allison Hill, and also the case management supervisor at York Psych.
Thank you. All right, y'all. So today we're going to be talking about drug and alcohol treatment in an outpatient setting. And we recognize that drug and alcohol treatment exists across the lifespan, right? Across the different levels of care. We can have inpatient, we can have different partial-based treatments. Obviously, you have medical assisted treatment. It's very popular, gained a lot of popularity since I entered the field several years ago. At Pennsylvania Counseling Services, we provide treatment predominantly in outpatient setting. Typically, that looks like an individual starting with a level of care assessment, meaning they come in, it's about an hour, they fill out a whole bunch of paperwork, and then based upon their symptomology, based upon their substance use and the progression of their course over the course of their addiction, we make recommendations about what might be the best fit for them. Here at PA Counseling, we only offered two different levels of care. So we offer traditional outpatient, which tends to be about once a week. And then we also offer an IOP level of care, which is 3 times a week, up to 3 hours at a time. Occasionally, each of our levels of care also have additional recommendations, like maybe a co-occurring, where they come in twice a week with a little bit more intensive work looking at their mental health symptomology. We also have some specialty-based drug and alcohol groups. So we have one that's dialectical behavior therapy that looks at a more skills-driven treatment modality. Kristen, I also know you do the Seeking Safety group, which is designed to address concurrent substance use and trauma symptoms. We work with children, adolescents, and adults across the lifespan. We also, depending on the location, we have some ancillary services. So as you mentioned, we have case management. We always have different grant programs that come and go to support maybe women struggling with substance use and postpartum or pregnancy-related concerns. We also have certified recovery support specialists that provide a little additional support there as well. Treatment ranges anywhere from 3 months to 6 months, although the research does often suggest a little bit longer tends to be useful, so we're working on ways to expand that out. And then we also have in-person services, hybrid-related services, where they do some in-person and some online, and we're moving towards a fully telehealth model as well that would still have a few in-person commitments, such as drug testing and maybe individual within the community-based setting as well. So that is like the 10,000-foot view of the work that we do. From your perspective, what did I miss? What are some things that are inherent in the drug and alcohol treatment model that maybe I didn't mention? I know each of you have a very unique perspective or work in different settings, so I really want to open it up and hear more about how treatment works in your individual settings, because obviously I can speak to PCS as a whole, but with 14 different locations for outpatient, it looks a little different depending on where you're at. So tell me what I missed.
I will say the bilingual or Spanish-speaking services is something that we're fortunate enough to have at several of our locations. So you mentioned like hybrid models, that's available in York, and there's different resources for that as well, which I think is really important in many of our communities.
Yeah, thank you. And you lead much of our Spanish-speaking program in Reading, at least.
I do not.
Oh, you do not?
No.
Drug court is your
Yes.
vibe. Okay.
Treatment court is my thing, yes. Juan Ramirez is the one that runs the bulk of our groups.
Juan runs the bilinguals.
And we do have a full IOP, outpatient, co-occurring, and critical intervention, which is for the first-time offenders.
And that's all in all in Spanish?
All in Spanish.
Oh, that's such a gift.
Yeah, it's amazing.
Yep. We also have people to help translate for psychiatry because a lot of our folks do end up seeing psychiatry as well.
And our psychiatrists can provide medication management and a whole host of different things in addition to like mental health things.
Correct. So we assess for that right at the intake, whether or not somebody needs psychiatric services in conjunction to drug and alcohol.
So you are our primary guy when it comes to treatment court.
Correct.
Speak a little bit about what treatment court looks like. We have overlap in other counties, but nothing like our relationship in Burke. So I would love to hear a little bit more about your experience there.
I've been involved with treatment courts for, I think, 18 years.
Oh
So
my
I've
goodness.
seen it grow. It started out as just drug court and then got split into mental health court as being separate, as we saw it as a separate need. And from there, it's grown to DUI court and veterans court as well. So I attend all 4 sessions. The judge is wonderful. She's been with us for about 10 years.
Oh, that's great.
The DA is super supportive. I've seen DAs argue to not incarcerate people.
That's crazy.
It's a diversionary program to avoid jail time and to try to end the cycle of repeated incarcerations and reoffending. A client is applied usually by their defense attorney. So they go through an application process. We're trying to get them involved with treatment as soon as possible, but that doesn't always happen. So we have a new applicants meeting where we discuss each person, and if there's something that may keep them out of the program, then we discuss it and take it on a case-by-case basis. There are certain crimes that are not accepted at all, so violent crimes, gun charges, sex offenders, those kinds of charges are not brought in. Typically, we see the multiple DUIs, the retail thefts. We get a lot of aggravated assaults on police officers during mental health crises. And then that ag assault is dropped and they plead to a simple assault. So the client has to be willing to plead guilty to something. And usually they try to drop the severity of the charge so people can avoid felony charges as well. And it's a very intensive program. It is roughly 18 months where you're seeing a judge every 2 weeks.
Wow.
And the point of that is that the judge can respond almost in real time to behaviors with both service adjustments, is the term we're using now instead of sanctions, or rewards. So clients get small rewards at every session and then get bigger rewards along the way. We just opened up a treatment court store where a client is given almost like Monopoly money and then can build up money to buy pretty decent things in the store to reinforce positive behaviors.
That's really cool. That's really cool. Thank you for doing that overview. I know you've been so intimately involved with it for so long and really watched it grow. And you have a enviable relation. It seems like Berks County has really figured out a path towards, and I mean, I've worked in different counties and different programs. And you don't always see a high level of coordination across the judicial support, the DA's office, the public defender's office, treatment. You don't always see what y'all have. So it's a beautiful system that Berks County has developed. And I imagine it seems to be really positively impacting a lot of lives.
Our numbers beat the national average in terms of recidivism.
That's awesome.
What's the typical length of stay?
For a treatment court,
Yeah.
it's about 18 months.
Okay.
I've seen as long as 3 years
Yeah.
when people struggle, but it averages about 18 months. The shortest is 12.
Mm.
And then we try to keep at least with PCS, we try to keep the client engaged with services throughout the entire time.
Mm.
We try to not discharge until they're done with treatment court and a little bit past that.
I love that.
So we'll start out with IOP, drop down to outpatient, where outpatient is group once a week, individual once a week or every other week, and then drop down to just individuals. Eventually, we're down to maybe monthly individual check-ins. So that way, there's always some connection with treatment if there's an issue.
George, I really like the one time I went with you to drug court. Like that was like such a moving, like spiritual experience, gospel truth in lots of ways.